The team responsible for the evaluation of potential living donors is called the Donor Advocacy Team, or DAT. Our interest is the determination of suitability for such an operation and to maximize the safety for the donor. We want to make sure there are no medical or psychiatric disorders that would make donation more risky or difficult. The DAT wants to be sure each donor is acting with knowledge of risks and benefits and is making a free and voluntary choice without coercion. We require that all testing is done at the Cleveland Clinic. Potential liver donors will need to set aside several days to complete an evaluation. Although in extreme circumstances, the process can be completed within 24 hours. The evaluation process is divided into 3 phases. Phase 1. A person wishing to be considered as a donor should call the liver transplant office and become aware of his or her blood type. Our office will not initiate contact with the donor and cannot respond to requests made by potential recipients or family members. When a potential donor calls our office, they should inform the receptionist of their interest in living liver donation. A member of the team will then gather demographic information over the phone. The potential donor will be contacted by a living donor coordinator who will gather more detailed medical information and answer questions. Information gathered will be reviewed by a liver transplant surgeon. If the surgeon feels that criteria are met, the living donor coordinator will contact the potential donor to schedule an in-person evaluation. Phase 2. During a visit that typically takes 3 to 4 days, a potential living donor will undergo several interviews and evaluations by the following donor advocacy team members: living donor coordinator, social worker, independent donor advocate, a formal medical evaluation by a liver specialist, also known as a hepatologist, a formal surgical evaluation by a transplant surgeon, transplant anesthesiologist, and a nutritionist. Other visits may be scheduled, for example, with a transplant psychiatrist or a hematologist. The goal of these visits is to ascertain the potential donor's state of health to ensure all reasonable known risks are understood and to be confident that the donor is exercising independent, mature judgment. Every opportunity is provided for a candidate to withdraw from the consideration at any time. Many blood tests, cardiac tests, and imaging studies, including CT scans and MRI scans, will be performed. Risks associated with Phase 2 testing include the following: allergic reactions to contrast agents used in imaging studies, discovery of infections that need to be reported to public health agencies, discovery of adverse genetic findings not previously known to the donor, discovery of abnormalities that may require more testing at the donor's expense, or require the need for unanticipated decisions on the part of the liver transplant team. Phase 3. Occasionally, individuals may need to return for more testing, including a consultation or a liver biopsy. Decision-making is a several-step process. The donor advocacy team will have a discussion about a potential live liver donor after Phase 2 testing is complete. The donor advocacy team makes a judgment either to recommend, not recommend, or defer a candidate. The final decision about acceptance is made by the Liver Transplant Selection Committee, after hearing a report from the donor advocacy team. Both the donor advocacy team and Liver Transplant Selection Committee put the interests of the potential liver donor ahead of all other considerations. Donor safety is our top priority. The results of this decision-making will be conveyed to the candidate by the living donor coordinator. It is important that a potential donor takes as much time as necessary to absorb and process the information provided, and to discuss all aspects with family members and others. Please remember, at any time before surgery, a living donor candidate may have a change of heart. Such changes will remain confidential between the potential donor and the recipient.